get behind. You mentioned Dale Folwell, the state treasurer. I believe he's running for office as well. But we won't get into that necessarily. But he actually has called the North Carolina healthcare system a cartel because of something called certificate of need, appropriately named con laws. So as governor, and this is something that I ran on, one of my issues when I was running for governor. What would you do as governor to address the issue of con laws in North Carolina? And just briefly explain how you think, in your view, that those laws negatively impact healthcare outcomes for the people of North Carolina, and then what you could do to kind of remedy that.
Yeah, absolutely. I mean, and that's in my website, firetheuniparty.com. If you look at my plank on healthcare, one of the things I call for is the abolition of con laws, right? The idea that certificate of need means that you go to your doctor or to your healthcare provider, go through a process, and then you have to wait for some administrator or bureaucrat to tell you whether you can actually get this done or not. And because of this process, you wind up in situations where you have people who are either on Medicare, Medicaid, private insurance that is trying to minimize their costs. You go through this certificate of need process and are told no. Many times against the wishes of the doctor, where the doctor says you want this procedure, but because of these layers of bureaucracy and these, quite frankly, useless and unnecessary and damaging laws, that doesn't get done. We have to pull all of this regulatory environment out of there, especially when you look to some of the rural counties in North Carolina. Here in Gaston County, we're getting a nice new hospital, right? We've got some pretty big hospitals around there, but some of the rural counties, these laws that were put in place, because a particular machine may be 10 years old instead of 7 years old, they're being told, no, you can't do that. So now that particular practice is either the doctor's going out of business because they're not willing to buy this $5 million machine to comply with this piece of legislation, or you're just not getting the healthcare outcomes and you're having to put people elsewhere. Any of these barriers that get in the way of the doctor-patient relationship and any of the things that add needless layers of red tape and bureaucracy are driving up the cost at every level. At the doctor's office, in the hospital, at the insurance company, throughout the layers. You have to get these barriers out of the way. Because you look at what's happened in areas where the government is not regulating healthcare. Think cosmetic surgery. Think LASIK. You have these areas where there's no government dollars involved. And even, to use one since you hit it there, almost any of these markets, the cannabis markets, you look what happened over the past 20 years in these areas where the government's not involved. Prices have come down. If we can just do that in everything, we'd have so much improvement in our economy, our healthcare system. But instead, we're looking at new ways to write new certificate of need laws and occupational licenses and all of these things under the sun that create barriers to entry for new players and ultimately only reward these big mega corporations, big hospital, big pharma, that have armies of lawyers and millions of dollars to fight back against it, and you get no innovation. So I'd look to get rid of certificate of need laws in their entirety, as well as most other regulations that do nothing but add cost to healthcare and get in the way of good outcomes.
The bromide of the Libertarian Party is free markets, free people. To you, Shannon, certificate of need law has been characterized as a cartel by many people, including Dale Folwell. Would you agree with that? And what would you do to bring more of a market freedom approach to healthcare?
Very, very much like Mike, we have the same approach here, where we try to limit barriers and bring the free market and get them involved, because at every layer of bureaucracy comes more cost. We see it with the con laws. We see it with the VA. We see it in healthcare across the board. So as we try to do the Affordable Care Act and healthcare for all, the government feels like now they have to start throttling stuff down. Everything gets more expensive, and it just becomes a huge cluster. Ultimately, the thing that will help North Carolina the most is for the government to get out of healthcare, and then have the free market take care of that, and then all of these laws are no longer a factor. So one of the things I feel that, as a libertarian, the ultimate goal of becoming governor isn't to do things, it's to undo things. And these are some of the things that will need to be undone.